Hi, I'm Hannah. I'm a first-year PhD student at the WITS Advanced Drug Delivery Platform, and I'm working with pediatric HIV treatment.
Every research is trying to solve a problem. What problem is your research solving?
So we're trying to solve the problem of adhering to treatment. So the everyday routine for hundreds and thousands of caregivers and children is waking up in the morning and crushing pills, measuring out liquid medicines, finding out how they can mask these bitter tasting medicines in food and drinks. And this often is going to result in, and this is something that's happening on a daily occurrence. So this is their daily routines. It's far from the ordinary. And we're trying to bypass that by creating a novel treatment that can be simple and easy to administer and that doesn't require daily dosing. So we're trying to solve the problem of treatment adherence, because treatment adherence, simply put, is missing doses, skipping doses. And that, especially with children who have HIV, that is a problem because it can result in treatment failure, which then results in disease progression, which means moving to, from the HIV will progress to AIDS. So treatment is very important, and getting the doses, getting the correct amount, that is very important. So that's why we're trying to here we are trying to formulate this novel tiny patch that can be applied to the skin, and it will actually deliver the ARV into the skin, and that patch can be applied twice a week. So it gives ease of mind to the caregivers, and we also will know that the children are getting their treatment and they're not going to result in any treatment failure or disease progression or even mortality. So that's the problem we're trying to solve.
Okay, interesting. How are you going to achieve that methodology?
So we have our objective set up. So the first part is to actually load the ARV into a novel system, and that novel system is a nanoparticle system, and that's how we're going to sustain the release. So we're going to aim for maybe release over a couple of days. And then we're going to put those nanoparticles into a microneedle patch, which can then be applied to the skin, and that's how it will deliver the ARV through the skin. So broadly, that's the overall objective in a nutshell.
Okay. How far is the project?
So the project is very much in its infancy. As I stated in the beginning, I'm a first-year student. So I started doing lab work. It's been about 3 months now, but we do have some working formulations for our nanoparticles, which we're going to move on to optimizing. So we had the first part of how we're going to load the ARV into the nanoparticles, and then the next part is the microneedle. So at the first part, but we do have some promising formulations.
Okay, thank you very much and all the best. Any closing remarks?
I think my closing remarks would just be to thank the NRF for all of their, for funding these projects, because they're really important, especially in this context, and also to other people to not be afraid of science. We need more people in science. We need more people also doing innovative work that's relevant to the context. So we are in Africa. We need treatments that are going to be solutions to the problems that we have. So those would be my remarks. Okay.